old trach and they have pneumonia. Also check if they have been coughing up a lot. Kind of see what their background is, you know, before you walk into the room. So this is just up front. And then I never take in the kit until I've actually talked to the patient. You hate to have a nurse coming in and plop down what she's going to do in front of you and say, well, we're going to change your, you know, dressing now. I mean, so you want to do that before. But it's always those first things you do first. So let me put this back together. Look at this where it was before. Okay. So the big part of this is the person, the doctor's order, the procedure, having the supplies, explaining it to the patient before you walk in the door, thinking about sterile and non-sterile, you know, decide which hand's going to be your non-sterile hand, which is going to be your sterile before you walk in the door. So when you come in, let them know that we're going to go ahead and do this. Now, it does cause a lot of anxiety, and one way I can show that is try putting pressure right here in your throat. Just put pressure there. Can you imagine having someone come in, I hate to say it, but fiddling around with that thing there, and it has to do with your breathing? I mean, that's kind of a frightening thing too. And of course, I wouldn't be doing like this with my hair either, if you kind of wonder about that. Okay, so I'm coming in and I need to have a pair of non-sterile. So I'm putting this back the way it was. So I'm coming in and I'm going to do a physical assessment, which is mainly to listen to lung sounds, to see what's been going on, to see what kind of drainage there is, and to kind of reassure him that I'm going to make sure that I talk about everything as I'm doing it. So I'm going to come in and I'm going to go ahead and wash my hands. I've already asked him who he is, the identifiers. And so right now, I usually always take the non-sterile dressing off first. Now you'll find some books that'll say go ahead and do it at the end, but I don't want that yucky thing sitting there while I'm trying to do things sterile around it. Okay, now Proctor said that if you do it first or do it last, do the dressing, that's fine. Either way, it's just that you have to keep it. There we go. Okay. That's okay. Okay, so what I'm going to do is, it doesn't matter now if it's sterile, non-sterile. These are clean gloves, and I wash my hands. I put my clean gloves on, and I'm going to tell them that I'm going to go ahead and take this out. Okay, and you want to go ahead and throw it away. Okay, now at this point I'm going to take off my clean gloves. As you all know, you wash your hands again. And how many seconds do you wash your hands for? At least 30 seconds. So it's not the antiseptic we're talking about. It's actually washing your hands. Okay, so I'm going to go ahead and bring this in. I'm going to open it up. And as you know, it'll be different every time you open one of these kits. You go to the hospital, you'll get another kit, you'll find something else there. And you have to figure out, how do I get through to the kit? Okay, now see what I did? I put that drape on top, and I need to get to those gloves. So the good thing about this is I have the shiny side up. So I'm okay this time. What if I didn't have the shiny side up? I'd be picking through things. So I can still put it on and keep it sterile. The problem with our dummy here is that it's hard to stick this underneath them and without it sliding off. So it might look like I'm going unsterile, but I'm having problems with my drape. So we're going to go ahead and put this around here, and again, I'd have to be sterile. Okay, so now these are the gloves. One time we had a student where the gloves were just, and it took a bit. You know what, let me fold them the way they are. Like this. Like this. Okay, now this would be a problem thing. I probably would start all over again if this is my kit. Okay, so this is the way they would be. Okay, so now I'm going to do the sterile, which, as you know, is finding the cup, putting it on, and then put this underneath here. And you know to always make sure that everything is above your waist, to not have anything behind your back. Okay, now my non-sterile hand is my left hand. Okay, so everybody needs to pick a hand that's going to be non-sterile for everything. Okay, because if you keep flipping, you'll make you know. And so, you know, pick whatever hand is the best hand. Okay, so what I'm going to do is get everything ready. I've not started yet. So I'm going to go ahead and pour in my hydrogen peroxide. And you want to pour in both packets because you want to be able to put the inner cannula in here and have it soaking. Okay, so everything is still sterile. I'm going to open this. Now these should not have been lying over the side. You always want them not over this way. Well, one student said, well, just go ahead and get this all kind of wet with saline, so it's all ready to go. Okay, but kind of do like this so it's not all dripping, and then just put it by the side. Okay, and then we're going to have this for later. Okay, you know what? I don't think I have my little cleaner. I left it down in there, so I will just let you know what I'm doing. Okay, so this is the non-sterile hand. So now I've got my dirty hand. So you can't put your arm on that, of course. So this is non-sterile. The end of the tube is non-sterile. Okay, and right next to it are two little pincers that you pull together. You see, I know you can't probably see it.
We'll have to get our hands on it.
Yeah. Okay, so what you want to do is to press down, because you don't want to pull up like that because the whole thing will come flying. So you want to press down while you're pulling out. So with my one finger I'm pressing down on the lip, and the other one I'm pulling out. Okay, so the end here is sterile or non-sterile. I'm going to put it in the hydrogen peroxide. And I'm going to back and forth, and you'll see the fizzy. Okay, you'll turn like fizz. Okay, you're going to go ahead and leave it there to kind of soak up. Okay, now I'm going to go ahead and clean this area around. And you know, like I said, the body is, I can only use this hand because this is sterile. Okay, now there we go. See, you have to really be thinking because you can easily contaminate by just putting your hand in the wrong spot. So in your mind, you're always having to think what you're doing next. Okay, so this is still sterile hand. So I'm going to pick up the sterile hand with and do this, and I'm going to clean. Clean inside, go all the way inside, and around and around, and then throw it away. Pick up another one. Clean around the outside and not touch space like I almost did. So you're going to do that. Okay, and then when I'm done, I'm going to do his skin, but right now I can't do that. Okay, so I'm done with the hydrogen peroxide. So I need to take this up with my non-sterile. Now this is clean, it isn't sterile, but this is really non-sterile. Okay, that's why it's with my non-sterile hand. Okay, now there is a pipe cleaner in there that's right in there, but pretend I have a pipe cleaner, and I'm going to push it all the way through to get some of that stuff out of there, and it's gunky. I had a home health care patient, this man who did not clean his inner cannulas. He would put them hydrogen peroxide, and I'd come, and they would all be floating around amongst all the stuff in there, and it was just so, so they probably look at you like, boy, you're really taking a lot of work doing this. I don't do it that way at home, but that's kind of the way it is. Okay, so I'm doing that, and what I'm going to do is going to go in here. This is a saline. Now the saline will get rid of all that stuff that's fizzy. Okay, so you always want to do the hydrogen peroxide first, the saline. Okay, So this is non-sterile hand. Okay, I'm gonna go back in again, and I can't touch it. No, this is sterile. So ordinarily when you're pushing back in, it's not as much of a problem having to hold that piece as when you're pulling it out. So you're probably okay. And then you just have to make sure that it stays put. You hear that click when it comes right in. And I usually kind of pull a little bit just to see, because one time there was a patient, it wasn't clicked all the way in, and suddenly he put on his light, and he said that when he coughed, the whole thing came flying across the room. It's because they stuck it in, but they didn't make sure it was pushed down and clicked. Okay, so now that that's in, I basically can use both hands, okay, because everything is in there. So right now, I'm looking at the skin around the area if it's reddened. The back of the head, many times, you know, people sweat, they have long hair, and it's reddened, and if you have any reddened areas, you know, more infection happens. So you want to clean that whole area. So a lot of times I bring in washcloths and some soap. You don't have it in your kit, but that way you can undo, and this is not a sterile procedure, you can undo part of it, you can put your hand on this, and you can kind of wash underneath, and then there is a 4x4 in here where you can really wipe it good, wipe right around the neck, but always do just one of these at a time, and then you can go ahead and do the other. Now, in between all of these things, as I'm talking, I would have his oxygen back on. I did not put it on fast enough. As you're doing one thing and you put it back on. That's why it's important to do a pulse ox before you start. And if its pulse ox is low, like 90, you're thinking, oh my land, I better get that oxygen on. Bam, bam, bam. If it's been 96 and he has oxygen on, you have to get back on. It's not as fast.
You just keep touching with your non-sterile hand to move it back over? Like
Yeah. So like with me would be my left hand. But I have to keep thinking, I've got to get that oxygen back on again. Okay, so I've gone ahead and I've cleaned underneath here. If you have to change the ties, because sometimes they really look awful. And again, all the suctioning should be done before this. So I would never come in and clean the area until I had suction this. So I'll come in and listen to their lungs, know that they're congested, suction first, hey, to do all this, then you suction, and oh my land, it's all over the place again. Now, in a half hour to an hour, this person might have to be suctioned again, then you get all the way dirty again, and you gotta start over again. But always do the suctioning first. So if you have to change your ties, have someone come in to help you, because you know it's rather frightening to be holding this down, undoing one by one. You do one of the ties, put it around the back to the other, but it's good to have a second person.
Make sure the patient has a mask, okay, get all your supplies ready.
You know, I did this one faster.